Hi everyone, I'm Dr. Kara, and wow, are there a lot of tools out on the market these days that we're using to help us move better. In this video, we're going to talk all about all the different types of tools out there, such as foam rollers, balls, mobility sticks, and other things, and what they're used for, and how I recommend using them on some of my favorite common problem areas in the body. Mobility can be improved by using tools. How? What do all these tools do? Our skin feels and senses information from the environment, and our brain determines what to do with it. When we get better info, we can then produce better movement. We use these tools to manipulate our myofascial system and to normalize muscle tone. This helps them work more efficiently. What is the myofascial system? Our myofascial system is our muscle and fascial network. Fascia is our most important perceptual organ made up of many receptors that are sensitive to mechanical deformation when different stimuli are applied to the skin, either light or deep. Deep pressure is not needed to generate a reduction in tissue tone. Light pressure can actually work to provide pain relief and a sense of well-being. So when we're talking foam rollers come in two different densities. There's a soft roller, this pink one, and you can always email me for information on these specific products. But this is a soft roller, this is a hard roller. When you're first starting out, I recommend that you start with a soft roller. And if you have low bone density in your spine, then I really don't recommend that you do foam rolling on your own at home at all in that area. Okay, so you start with the soft foam roller, which is great for the spine because it covers a lot of surface area. And you're just going to lean back on that foam roller, put it right underneath your bra line area, and then you're just going to lift your hips up slightly, support your head, and just roll from the top of your shoulder blades to the bottom of your rib cage. So top of the shoulder blades, down to the bottom of your rib cage, and you're just going to go through the spinal area, mid-back area for about 1 minute. So most of these, 1 minute is good. The longer you do it doesn't necessarily improve. Research shows that longer isn't better, but you want to make sure that you at least spend a good 30 seconds, a minute to 2 minutes in each area that you are trying to affect some change in. So you're just going forward and back, and then I like to just drop the hips down and spend a few repetitions just extending over this foam roller, taking some deep breaths. Then maybe pick a different spot and just work on opening up that chest and spine, that upper back area, taking some deep breaths. And then I'll move down into the hips. So I'm going to go into the sacrum and the hip area, and I'm going to sit on top of the roller. So you want to make sure you're well supported. Just put your hands behind you. And then I like to start just rolling through the middle. So I call it rolling through the middle. You are targeting rolling through those SI joint ligaments and the muscles. And you're going to roll through here for about a minute. And then you're going to cross your right ankle on top of your left knee and shift your weight into your right hip. And then you're going to roll for another minute, just specifically through that right buttock. So all the flesh of your right buttock, you're going to get in there with your foam rollers and just roll through there for a good minute on each side. Now, if you have been rolling for a while and you want to go deeper into that area, another tool you can use, and why I have so many tools out here, is because this 5-inch ball is going to help you get deeper into that area. So you can place that ball underneath that glute area. Since we're talking about the glute area, you're just going to lift yourself up again. You put that ball underneath there, cross that foot, and then you're just going to roll around. And the idea with foam rolling and using these balls is to kind of search and destroy. So you look for those tender spots and you get on them and you appreciate those. And just applying some pressure in there is going to help reduce that tension and tone in that muscle fascia layered network through there so that you can activate and use those muscles better when you do things. Okay, so you're just going to go all around into those glutes on both sides for a minute. And then after the working on your spine and your glute area, I like to get into the thighs. So into the thighs, there's different ways you can do that. So with the foam roller, you can work on getting into the hamstrings, so back of the thigh, just by putting it underneath your hamstring area and rolling from, you want to make sure you roll from your seat bone down to about the middle. Since our thighs are long, you need to kind of section them and roll them in sections because you won't be able to manage your body weight and roll the entire thigh at one time. Or maybe you will. But I like to do mine in sections. So you're just going to roll the top of the thigh and then you're going to move down into the middle and back of the knee area. And you're going to roll there for a minute and you'll do both sides and then you work your way down into the calf area. So in the calf area, you can use the foam roller. And it's good to use more of a firm roller in these areas. So I'm still demonstrating with the soft one, but if you have the firm one or you have more than one option at home, you could switch to something a little more firm and you're just going to work on rolling through that calf the same way. And you can also do this with the balls and get in there and get a little bit deeper into the muscles using lacrosse ball, tennis ball. The lacrosse ball works great in the calf to target some of those really tight points in the calf area. So this is a mobility stick by Skills, and it's SKLZ. And again, if you want to find these specific products, I can give you the information where to get them. But these sticks work really great for just using on your thighs, all over, top of the thigh, inner thigh, that outer thigh. And you can do this while you're sitting on the couch, just throughout the entire region. These also work really well for the calf area where you want to get more specific into your calf or down in that Achilles area, which often gets tight and limits our ankle motion. So these mobility sticks are great to use as well. I hope you found this video helpful. If you would like to gain more mobility and strength to feel better in your body, I offer a free club membership where you can enroll to receive my weekly excerpts and more. Just click on the link in the description, and if you have any questions, feel free to reach out to me via text, email, or Instagram. Thanks for watching, and let's keep getting stronger and more mobile to live longer.